It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
That's right, Candace, and speaking of best, we'll start off the show with one of the best plastic surgeons in the entire Dallas-Fort Worth area. It is plastic surgeon Dr. David Azouz.
I had a condition called true gynecomastia, and the condition is basically a hardening of tissue in the chest area. And so unlike some of the other people that have that, it was actually hard tissue, it caused pain, and it was pronounced through clothing, things like that. It was more pronounced on one side than the other. And so that kind of began the search where I looked for doctors for about 3 years.
Gynecomastia is a very common problem for many men where they have the physique in their chest that's more female or feminine, and that's why it's called gynecomastia, feminine breasts on men. And obviously most men are not happy to have breasts, and they want to have that corrected. So they like to have prominent pectoral muscles, they like to show a lot of musculature, but they don't want to have breasts.
So I talked to my primary care physician, and then I started to look at different plastic surgeons in the Houston and the Dallas area. And without even examining me, most of the doctors would tell me the procedure right off the bat, and usually that entailed to do multiple cuts around the area, multiple incisions, and then go in and from all angles kind of, take out that tissue. So I knew that that wasn't something that I really wanted to do because it was going to leave a lot of scarring. So I put it off, and it ended up, like I said, it took about 3 years. And the first time I went into Dr. Azouz's office, he told me flat out, I'm going to, stay here until we answer all of your questions. And he kind of went beyond that. I mean, he came up with questions that I wasn't even thinking about. And within a few minutes, I knew he was the man for the job. I mean, he actually examined me before he made any recommendations, and then he kind of went through the whole procedure. And the procedure was going to be, 2 really small cuts, which I kind of didn't believe at first, to be honest, because I'd been told by so many other doctors that that wasn't possible, that they would have to do multiple incisions.
What we do is we take off the breasts by making small incisions under the areola, and through liposuction and sometimes excision as well, we remove the breast tissue and we give them better contour.
Now that the procedure's done, all I have is praise and thanks for Dr. Azouz. Without him, I would have probably gone to one of the other doctors and been unhappy with the results. My life has truly changed as a result of this procedure, and I would highly recommend it to other people.
Well, Jesse came to me complaining of low back pain and leg pain. It had been plaguing him for several years and been progressively getting worse. It was to the point where it was affecting his job.
Every time I had a back spasm, I'd be out for 2 or 3 days where my back would hunch over for, I'd be stuck in this weird, awkward sideways position, hunched sideways. And every night when I went to sleep, I dreaded going to sleep because I knew I'd wake up in pain. Sure enough, it was a bulging disc on L4 and L5. Well, initially, and my doctor referred me to a spine specialist that he was familiar with and comfortable with. So I saw him for a while. I went in for cortisone injections. Went through that, went through physical therapy, and all of it helped, and it did help alleviate some of the pain, but it eventually came back. So the doctor recommended actually having some type of invasive surgery. And it was something I just felt really wasn't comfortable with. And luckily at that time, Dr. Williams told me about the Curoscope procedure.
The Curoscope procedure is a minimally invasive spine surgery that addresses conditions of the spine, including herniated disc, bulging disc, degenerative disc, and/or scar tissue in a patient's spine.
And the way he presented it was here are the facts, here's what's been done on other patients, and here's the proven success rate.
You know, oftentimes patients come to me, you know, and they're in so much pain and have their extremities affected so much that they can't walk without using an assistive device. That'd be a wheelchair, a cane, a walker. Upon doing the Curioscope procedure, a lot of these patients no longer need an assistive device.
When I woke up from the surgery, I knew that it had worked. You know, there was this weird feeling of intense pressure gone from my back.
After Jesse had the Curioscope procedure, he followed up with me, and I determined that Jesse's pain was 100% gone.
I have now been able to focus more on work, focus more on and enjoying my family, getting just good quality sleep. I've been pain-free for 9 months now.
After a workout, don't eat carbohydrates for at least an hour. Your body will be forced to break down body fat rather than use the food that you have ingested.
I came to Dr. Lewis because I always wanted to have really white teeth. And my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way, didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger. Even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness, but it's derived from the bond to the tooth. And we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great. It
was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
All of our doctors here at the Best Docs Network are dedicated to changing people's lives, and our next doctor is no exception. It's hand surgeon Dr. Dustin Ray.
Carpal tunnel syndrome basically is a problem where you have a nerve that's here in your wrist. That nerve shares a common space. It shares it with 9 tendons. When those tendons swell, that soft little nerve gets pinched. The patient can then begin to have numbness and tingling, and if it's there long enough, can notice that his grip strength or her grip strength is diminished. It's important to treat carpal tunnel syndrome early and not wait too long, because the longer that nerve is pinched, the greater the chance that nerve can become permanently damaged if left untreated.
I've been dealing with hand numbness and pain in my hands and fingers for probably 15, 20 years. It progressively got worse, and it got to a point where I couldn't sleep anymore. I couldn't write much more than a check out without a pen falling out of my hand. I would run my fingers through my wife's hair and not be able to feel it on my fingers. And I was missing out on a lot, keeping me up at night or waking me up at night. It would hurt all the way up into my armpits.
When Steve came to see me in the office and he told me his story, it definitely sounded like he had carpal tunnel syndrome. After examining him, And after getting a nerve study to confirm what we suspected, it came back positive for carpal tunnel syndrome in both of his hands. So we proceeded to do the surgery to treat his carpal tunnel syndrome.
The procedure we went with was the endoscopic. I can sleep at night now. I can feel my wife's hair whenever my hands are, run my fingers through her hair. I'm doing just about everything I used to do before.
The good thing about endoscopic surgery is instead of waiting this, a long recovery after one surgery for one hand, we operated on Steve within a week and a half after his first surgery. So he basically had both of his hands done in 1 month.
I wish I hadn't put it off for so long. I don't know how many things I put off because I couldn't use my hands like I wanted to before. You can actually feel my hands and do things, and it doesn't hurt to pick up a pair of pliers or pick up a wrench. I'm glad that I found Dr. Ray, and everything's been great since.
We all get leg cramps. Usually it happens at night and they can be severe. I get horrible leg cramps after I play racquetball. They're bad enough they make me cry. What causes leg cramps and what can you do to prevent them? Well, there are 3 or 4 causes. Number 1, dehydration. If you're not drinking enough fluids, especially after exercise. If you don't have enough fluids, when you lie down, you become horizontal. The blood flow doesn't increase as it should to your legs because you're horizontal and you're a little dried out from dehydration. And when you don't get blood to your muscles in your legs, they cramp up and they hurt. Also, low potassium. If you're on diuretics for your high blood pressure or for swollen ankles, your potassium may be low, and this too is a very common cause of leg cramps. That can be fixed with potassium tablets. Magnesium may be a problem too. You can have that checked with your doctor, but the first thing to do is just try over-the-counter magnesium. 400 milligrams might do the trick. Stretching will help also. The main thing is you want to stay well hydrated, especially after exercise.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
I had been living with neck pain for about 15 years. It took a few of those years to figure out that it was really my neck. It was horrible, lots of neck pain, terrible headaches, nerve pain down my arm. My middle fingers in both hands would go totally numb. Makes it very difficult to work when your fingers are numb if you're working on computers. I had had a bulging disc in my neck. It started out to be just one bulging disc, but by the time we found Dr. Rimlawi and got in to see him, I actually had 3 bulging discs.
We looked at her neck and I said, unfortunately, it was a big portion of her neck. It wasn't just one level. A lot of times people come in, they have 1 or 2 levels. And poor Tara, she had about 75% of her neck that was involved, that had some type of problem in it. She kind of felt that she wasn't fixable. She wasn't able to do the activities that she normally liked.
I couldn't do important things anymore, like my husband and I couldn't go dancing. I couldn't go on walks with my son. We couldn't go play at the park, to the point of not even being able to lift a gallon of milk out of the fridge. The quality of life had diminished greatly, and it was very depressing.
This type of surgery she had, normally it would have a big incision really from here all the way down. A lot of muscle cutting, a lot of bleeding. So there's a little trick where you can go in between this muscle and this muscle, right between them, right here, and you can get away with really not cutting or hardly cutting any muscle at all. Cosmetically, it's better for the patient. Pain-wise, it's better for the patient. Recovery-wise, it's better for the patient.
The relief that I've gotten from Dr. Rimlawi and the minimally invasive procedures is such a godsend. It has been such a blessing in my life and has given me the quality of life back.
She's like a whole different person now. That's the best part about this. You see a patient, it's amazing how much neck pain or back pain can change their life and make them into somebody they're not. And then now I see her and she's so happy. That for me is the ultimate gift.
If you have asthma, do not let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer. It has the highest cure rates of any technique of treating skin cancer and enables us to preserve as much normal tissue as possible while still removing all of the skin cancer. The technique is very much like the biopsy in that everything is done in the office. We just use a little local anesthetic, numb the area up, and remove the area that we can see. The way in which it differs from the biopsy is that we take the tissue that we excise and prepare it in our lab. We make our own slides, and I examine the slides under a microscope to determine if we've gotten all of the skin cancer. If we have, we stop there. If we haven't, we know precisely where any residual skin cancer is. We go back just to that area, remove a little bit more tissue, make some more slides, and keep repeating that process until we're sure we've gotten all of the cancer. If the skin cancer is very small and very superficial, the wound that results from the surgery that we do may be very similar to the wound they had after the biopsy. Very often it will heal satisfactorily on its own with good routine wound care. However, if the skin cancer has invaded more deeply or is wider than what it appears to be on initial exam, then we may recommend a repair of some sort. And they range all the way from simple side-to-side closure to a skin flap or a skin graft. And as with all cancer, early detection and treatment is the best way to cure skin cancer.
Don't forget, for more information on any of our outstanding doctors you see on today's show, even request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And now we're going to check in with our next life-changing story. It's from Dr. Scott Stowers, bariatric surgeon from Bariatric Solutions.
I've experienced in my past excessive weight gain. I would diet, lose, gain, lose. I was embarrassed. I was ashamed. I didn't feel good, and the more I gained, the less I felt confidence. I had made the choice that I needed to really make the decision to change my life, to get my health back on track.
Charla had a lap band procedure, which is one of the most common procedures that we do. She's been very successful for her. She lost her predicted weight that she wanted to, and several different medications she took, she doesn't take anymore.
I decided to have the bariatric lap band at Bariatric Solutions. I have a lot more energy. I strive to do things that I wouldn't have before, experience some exciting things on some of my travels.
A band is put in laparoscopically through small incisions in the skin. We put the band around the top of the stomach, and it's a balloon, essentially. It has a port that goes up under the skin, and we can put salt water in there to tighten the band up. That keeps the food in the top of the stomach and makes people feel not hungry with a small amount of food. It works like a long-term diet, only you feel full with small amounts of food. The most important part of a band patient doing well is frequent follow-ups and getting their band adjusted, especially early on. First 6 months, we will normally do about 5 adjustments until they learn how to use the band. After that, maybe one every 6 months, and then later on, maybe once a year.
My experiences with Dr. Stowers and his staff is so easy. I arrive, I'm seen in a timely manner, in a professional manner, and people are so friendly and they treat me as a family. Each time is very special And I look forward to seeing the doctor. He's very friendly, very cordial, and very professional all at the same time.
Hi, my name is Dr. Dustin Ray. If you're having a lot of pain at the base of your thumb or pain in the other joints of your hands, you probably have arthritis. To learn more, watch my videos at bestdocsnetwork.com.
When we do breast augmentation, one of the most common complications that we're trying to avoid is capsular contracture. And what that means is when you put in an artificial device in any person, whether it be a breast implant, a pacemaker, or an artificial joint, is the body makes a layer of tissue around it called a capsule. That happens in the first week, and that's the patient's own tissue. And that's a normal response. Unfortunately, in a minority of patients, that capsule can start to contract down and harden. So the breast implant, instead of resting on the chest like a dome shape, becomes rounded, pulls up, distorted, and can become painful. After breast augmentation, there are certain measures that are employed to try to prevent capsular contracture, and most commonly is to massage the breast implant daily. Nevertheless, probably about 20% of patients over the next 5 to 10 years are going to get that hardening. Now, traditionally, it's been taught that the only way to correct that is to go back into surgery and surgically remove that scar tissue and replace the implant. The aspirin after surgery actually gives us a non-operative measure to treat that. And what is involved is this: the impetus for that contracture or hardening seems to be bacteria, and it can be seeded from the breast because it's an open gland into the environment. It's the bacteria that's found on that capsule is normal bacteria found on the skin. But what happens is when it lands on that implant, it acts differently than bacteria elsewhere in the body and forms what's called a biofilm, like a shell around it, so that the antibiotics can't eradicate it. What the aspirin after surgery treatment does is an ultrasound device specially designed for the breast that imparts energy in to break up that biofilm so that the antibiotics we prescribe can then eradicate the infection and soften up the breast implant again. Now, when we see patients, the success rate of this depends on how severe the contracture is and how long they've had it. But in the typical patient that comes to us, if it hasn't been too long, if it isn't too far advanced, but it's distorted enough that they can see the distortion and feel the hardness, we get about an 80% response rate.
For more information about any of our outstanding doctors, even request an appointment, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, it's time to head to our next best doctor. It is Dr. Clay Cockerell.
A lot of people don't really know what dermatopathology is. Basically, what we do is if you go see a dermatologist and they look at your skin, and not always dermatologists, but mostly dermatologists, and they see something that they're worried about, or you've got a skin rash, they'll take a skin biopsy and they'll send it to someone like me to look at under the microscope to give them an answer. Basically, as a dermatopathologist, what you do is you go through training. You can either be a dermatologist trained first and then take another year or more, and then you're specialized as a dermatopathologist, or you can start off as a pathologist and then take a year of fellowship training and then take an examination, and then you also can be board certified as a dermatopathologist. There are a lot of skin diseases that people can get. I mean, if you open up a textbook of dermatology or dermatopathology, there are literally hundreds and hundreds of diseases that people can be afflicted with. And so when you go see your dermatologist, you know, they're trying to figure out what you have, and so one of the things they do is take a skin biopsy. Sometimes the answer is very easy under the microscope. You can tell right away, like for example, a lot of skin cancers are real easy to diagnose. Others may be more difficult to diagnose, especially some of the skin rashes that people get. A lot of them can look kind of alike under the microscope. So we'll often call a dermatologist and we'll discuss a case with them. Sometimes they'll actually send pictures. We'll look at the clinical photographs and correlate that with what we see under the microscope.
Sometimes they'll even actually bring a patient to us to see, or they'll send them to my clinic, or we'll go to a conference where the patients are there, and then we'll kind of put everything together to come up with the right answer. Our goal is to try to get the best answer for the patient, because once we make a diagnosis, then they can start treating that disease appropriately and make them better. It is a rewarding field because we do make diagnoses and we do help people, and unfortunately I don't see a lot of patients, although I do still see patients at my clinic. But a lot of times we just get the slide under the microscope and then we try to figure out what's going on there. And most of the time we actually can help the patient and come up with an answer that improves the patient's lives, and that's quite rewarding when we're able to do that, and we get feedback from the dermatologists, oh, you really helped my patient, you got the right answer, and I was able to treat them appropriately.
Find out more about your family history. Finding out what your grandparents died of can provide useful and life-saving information.
We've been using preferred imaging since 2001, since I started practicing here, and patients universally come back telling us what a great experience it was. I'm an orthopedic surgeon, board certified in orthopedic surgery and sports medicine. I do a customized knee replacement that is a special technique that is customized for the individual patient. So that knee replacement is based off of an MRI that the patient gets of their knee, their hip, and their ankle. And through that MRI, we feed that into a computer, and it creates a three-dimensional model of their whole leg. And that allows us to be much more accurate in the way that we do the surgery. So the MRI for that knee replacement technique is absolutely essential. It's a special MRI, and Preferred Imaging is specially certified and trained to do these special MRIs. Well, we love Preferred because they do a fantastic job for our patients. They get our patients in right away. They do a wonderful job at customer service and making sure the patient's comfortable through the whole experience, and really just guiding the patient from start to finish through that sometimes scary experience, and making sure that they are as comfortable as they can be. Well, MRI is a very integral part of an orthopedic practice because it's the best imaging test for musculoskeletal problems. So we use MRI quite a bit to establish a specific diagnosis, and that saves a lot of time and effort. You know, the quicker you can establish a diagnosis, the quicker you can get to the bottom of the problem and get it fixed. One of the greatest things about Preferred Imaging is that they have incredible hours, operating hours. They work from early morning till late at night and 7 days a week, and that convenience is an incredible thing for our patients because they don't have to miss work oftentimes, and they can get the MRI done right away, immediately, so that we get an answer to what's causing their problem, and we can get busy fixing it. We send patients to Preferred Imaging because we have full confidence in their ability to do a really good job for our patients, and they treat them well, and that reflects well on us.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com. Thanks for tuning in to another edition of the Best Docs Network, featuring some of the best doctors in the Dallas and Fort Worth area that are helping to change people's lives.
Yes, indeed, Candace. For more information about any of our outstanding doctors, even request an appointment, head to the website bestdocsnetwork.com.
And if you have a question or comment for us, we'd sure like to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.